to do any productive action, we need to actually be looking for them and making sure that we're tracking them and keeping on top of them.
3 COVID variants already identified here in Maryland. That's why Governor Hogan announced the state is more than doubling their sequencing or looking at the genetic code of the virus for positive COVID tests through partnerships with Johns Hopkins and the University of Maryland.
Increasing the sequencing allows us to know exactly what different forms of the virus are circulating in Maryland. Those key sequences would be important as far as determining if we need to make a booster dose of vaccine.
As of now, doctors say the current vaccines are effective against all of the known mutations. State health officials say in most of the 60 confirmed variant cases, the patient did not travel. So that means community transmission is already happening. And doctors say there are almost certainly more cases undetected. The sequencing samples will target patients most at risk for variants, like those who have already had COVID recently.
That reinfection or new infection is, again, that's a very serious circumstance that we would want to know more about. The second individual would be someone who's been vaccinated with either the Pfizer or the Moderna vaccine and then would be diagnosed with COVID-19.
Doctors say this virus has probably mutated before and likely will again. These mutations are more contagious, but not necessarily more deadly. But that could change in the future.
Other viruses, there have been mutations that have led it to become more of a problem for the individual. Right now, we're seeing that it's not so much of a problem if you're infected with one of these variants as much as it's a problem for those around you because you might be more transmissible to other people.
Doctors say the safety measures already in place, wearing masks, washing hands, and social distancing, are still your best defense against these variants. Reporting live downtown, Kim Dacey, WBAL TV 11 News.